Mayor Zavar said, I don't know. It happened in Sinania. Ay, my God, Sal, boy. 748. We'll keep it in the K-Wave News Zoom room. And let's go over to public health where we have Al Silverio, who's the public health mass casualty division lead, and Patrick Soto, who's the case investigation lead here, talking COVID-19, of course. Good morning, gentlemen.
Anthony, good morning.
Hi, Al. Hi, Patrick.
Morning, Chris and Sabrina.
Good morning. Al, we kind of know what you do from the last time you're on, but Patrick, if you could just give us a little job description.
Okay. Yeah, so recently I've been assigned to lead the investigation unit here in the investigation response team. My predecessor, Vince Uggan, had to be, relegated back to his program area, where he currently manages a grant for 4 different programs that operate under the capacity of 2 staff right now. So my job here is to oversee the operations of the investigation unit. So I report directly to my boss, Annette Uggan, who I'm sure you guys are familiar with.
Oh, yeah. Yeah, we love it.
So the investigation unit, as soon as a COVID-19 positive is reported out to DPHSS, once they're isolated, isolation team will come back to us. They'll say, hey, Patrick, this person is ready to be investigated. So that's when I activate my team. They go in, they interview the index case. During this interview, they collect quite a comprehensive list of information, such as symptom onset medical conditions, and then exposure history, right? So where do you work? Have you gone to any, have you gone outside of home or work, right? Have you gone to any grocery stores, any gas stations? Have you gone to GPO or Ross? From there, we collect a list of close contacts. Close contact, which I'm sure everyone already is aware of, is defined as a being within a distance of 6 feet for a duration of 15 minutes or more. From there, that list is passed on to our contact tracers, who will then reach out to these close contacts, do a quick assessment, a quick risk level assessment based on their exposure, and then they'll get them tested and then quarantined. So that's my job in a nutshell. We coordinate with the military to get a sense of, what is the military seeing on their end, right? We're all one island despite where we are. Do we live on base? Do we live on the other side of the base or outside of base? So we're seeing a little bit of mixture between both communities.
All right. So what can you tell us about, we had a statement come out from McDonald's over the weekend. We recently learned that some of our employees tested positive for of these cases. We closed the restaurant for deep cleaning and sanitation in accordance with CDC and local public health guidelines. We've been working with the Guam Department of Public Health and Social Services and conduct wellness checks at the beginning of each shift to ensure we limit the risk of exposure within our restaurants. In addition, we conduct regular sanitization of high-touch services within the restaurant. Our employees are the heart and soul of our business, and we're thinking of them and their families during this difficult time. That's from Jose Azuzu, the owner-operator of McDonald's. So what's the status of that contact trace investigation? And then also, could you comment on Kmart, right? So we had heard about some positives out of Kmart, but I don't recall the store being shut down and sanitized. And is that part of the policy? Why do we see some businesses, when they have positives, come out and say, hey, we shut everything down, we did all our sanitation, we work with public health, but in some instances, we don't hear about that?
Yeah, so I'm not going to confirm or deny that either of those were affected by, right? So they had workplace exposure. But what I could say is that as we come across COVID-19 patients who, they indicate where they work, we do reach out to their employers. We kind of guide them through next steps, right? What to do. So again, we'll identify those coworkers who work closely with the COVID-19 patient. We'll try to get them reached out to, try to get them tested, and try to get them quarantined as much as possible to reduce or mitigate the exposure or transmission of COVID-19. I'm sorry, Chris, what was the other question?
What's the protocol when you do have workplace positives? Are businesses required to shut down and do the sanitization? Because I don't know if they're just voluntarily doing that, or is that your actual policy?
That would be a question better posed to our environmental health officer. But what I do know is, right, when we have these exposures, when we have these workplaces, we do monitor them, right? So at any level, at any time when they have 5 employees who test positive, 5 or more employees test positive within the span of 1 week, that's when we do activate, right? So I'll notify Annette. Annette will notify the medical operations chief. who will then notify DEH, where they will then step in and kind of do an assessment of that establishment. Whether that establishment decides to close down, sanitize, that's entirely up to them. Me personally, I don't have the authority to shut them down, but it really just depends on the type of infection control practices that they implement.
Based on you said you guys interview the index cases, right? The index.
Yes.
All right. So what are your results kind of showing from based on your investigation in terms of how people are contracting COVID?
A lot of it is what we've been seeing in the past few weeks already. I mean, it's mostly just workplace exposure. Right? So you'll have an individual who will either be sick or asymptomatic. They'll go to work, they'll let their guard down. It'll transmit across the employees, and then those employees will go home, pass it on to their families. And it's just it's a chain, right? So those family members, if they're working, they'll then go to their workplace and then transmit it further. But yes, a lot of it is what we're already seeing, especially with the implementation of PCOR 1. With the shutdown, we're not really seeing so much community transmission. There's not so much like funeral gatherings, no rosaries, nothing like that, at least as far as I'm concerned, right? So I haven't met with my team yet. It is the beginning of the week. So who knows? It might change. It might change.
How
It's
long?
definitely going to change, actually.
How long have you been the lead investigator?
That is kind of a difficult question to answer. Ever since the end of May, right? The lovely days when we had 0 cases a day. We kind of gathered together and we're discussing, right, who's going to step up, because we noticed that everyone who's been pulled in from around public health, we're going back to their original program areas. So naturally, because I fall under ELC, right, the epidemiology and laboratory capacity, naturally COVID-19 fell under my jurisdiction, especially because I'm the flu and ILI project coordinator, project coordinator. So everything that's not STD, not HIV, not tuberculosis or Hansen's disease or even vaccine preventable diseases, that's all within my jurisdiction. So Shigella, dengue, salmonella, flu and ILIs. So that fell under me. And it's currently, recently we've brought on a few other staff members to help assist, but I am the, I guess, more senior member. So COVID kind of fell on me. So short answer is since June. Vince has been holding my hand for ever since then until back in September, mid-September, where he finally just stepped aside and just gave me everything to take care of.
Well, I hope he washed his hands.
No, he does.
How many case investigators are there?
I think 24. Sorry, I have to pull that number up. So roughly 24. But the important thing to note too is whether these are full-time investigators or part-time investigators. And we've been saying it, and I've been saying it too. A lot of these times, these investigators are going back to their different program areas. So we all pulled within BCDC, right? Bureau of Communicable Disease Control. A lot of times now, these investigators, either they're trying to focus on their program areas, and so they can't dedicate much time to, strictly COVID. But we are bringing on new individuals, and I saw the request that went in. So I'm excited to say that we're getting more additional help.
And it's help that you need, correct, to do these investigations?
Mm-hmm.
So 24, is it a majority are part-time? Because, the numbers show we're at like over 3,000 cases of COVID-19 on Guam.
That's just case investigators too. So there's a difference between case investigation and contact tracing.
Right, so contact tracers go and do their...
You're going to hear the same answer from me. A lot of these times, the full-time members are being relegated back to their program areas. So we're losing, our resources are diminishing. But we are requesting that additional help.
Al, I want to bring you on there, even though you're looking so handsome standing there with that shiny head. Good morning.
Hey, good morning, Serena. Good morning.
Good
Morning, Chris.
morning.
So I know that
Holiday.
last time we had you on about the funerals, but that's not all you oversee as the mass casualty lead with public health, right?
Correct. Correct.
What can you tell
We
us?
do a lot of things.
Go ahead.
All right. Well, what a new item is since we last spoke, Chris and Sabrina, was we now have a bereavement payment program for families who lost who lost a loved one from COVID-19, and this is a grant program that was identified by our governor and the Guam Economic Development Authority to provide a one-time payment to each family of $10,000 to help defray the cost of a funeral and the associated expenses. Many of our families wish to repatriate their loved ones back to their home country or home island, and this is very much an unexpected death. The usual point time between infection and death is about 3.5 weeks, so it's quite sudden, and most families do not have the time and resources to prepare for the death. Although we know that the vast majority of people with COVID-19 do recover, and we are fortunate that we have a high recovery rate, we also have 60 decedents on Guam since the pandemic started in March that succumbed to COVID-19. And this payment is to help these families cope and address the financial situation and gaps that the COVID-19 death has presented to them.
So, Al, if you could, the last time we spoke with the Department of Administration Director Edward Byrne, it was earlier last week, and he said that he was just waiting on the final approval from legal on the forms for the bereavement program. So, are you saying
Yes,
now
ma'am.
that the final approval has given and that families can now apply? And if so, where?
Well, it's still, we'll expect to finalize it today. I'm meeting with DOA this afternoon. And yes, you're correct with the legal part, because on Guam, there are some things that are not universally recognized around the U.S. jurisdiction, such as the status of common law relationships, legalities that are based on who is the next of kin and who rightly is supposed to be the beneficiary or the recipients of the money. So culturally, some of us recognize that a common law relationship, but in the U.S. legal court, it's not recognized as a legal binding contract between two people. So those things, yes, we have to figure out. We also have situations where the next of kin may not have the physical and or cognitive ability to administer or to receive the beneficiary money. So we make arrangements with the family, right? We let them be empowered and engaged to decide who is going to be the recipient of that check. It'll only be made to one person, and there may be a whole lot of people who are caring for that individual who died of COVID-19.
And so, if you can tell us what sort of documents do these families need to provide, and are they going to be from Government of Guam agencies that are open during PCOR 1?
Yes, well, we do have a very short but concise list of requirements right now. We do not want to make this a cumbersome effort by the families. The person must have had COVID-19 and died here on Guam. So right now it doesn't cover people who have COVID-19 who are residents of Guam, perhaps that had died elsewhere. However, we're going to consider that on a case-by-case basis, understanding that there are unique situations. Perhaps travel could not have been arranged back to the island, which could have hindered their return here. We also require a death certificate hospital that indicates the cause of death was either directly from COVID-19 or attributed to COVID-19 if they had underlying causes such as heart disease, diabetes, if they had pre-existing conditions of the brain, the liver, the heart that can be contributed factors to the COVID-19 death.
Just again, you said that the person that passed away from COVID, they have to be a resident of Guam.
Yes, ma'am.
Right. Okay.
Not necessarily U.S. citizen, yeah, but a resident
right.
of Guam. Yes.
Right. And so, what about this? You said there's a repatriation. Some families have indicated that they wanted to be repatriated back to their home.
Yes. We
So
do
can
honor
you-
those people, right? Because sometimes the wishes of the decedent are known before they pass on. And sometimes the families want to ensure that their loved one is interred in the place of their choosing. So repatriation means that the person is going to be removed from Guam and sent to another destination, whether it's Texas or the Philippines or Chuuk. That's what the repatriation process is. Those special cases, we do require more identification, an embalmer certificate, a death certificate, and disposition documents, meaning the body is going to be sent solely for interment purposes, not scientific, not exploratory. It's going to be sent to a place where it will be properly interred. So that's what repatriation is interment outside of Guam.
What about, because when we spoke with Mr. Byrne, he wasn't real clear in terms of where the funding was going to come from for the bereavement program. Can you tell us exactly, is it going to be federal money or is it going to be local money that's going to be used?
The total administration of this grant is a combination of that. It's local money and federal funds as well, because it is COVID-19 related. It's also being administered not only by the Department of Administration, but also supported by the Guam Economic Development Authority.
So are we talking about like the $117 million in CARES Act funding, a portion of that going to be used for this bereavement program?
No, that's separate. That's a separate source of money. This is a separate grant program from that. So no, yeah.
Okay, so no CARES Act money is going to be used for this program. It's another federal source of funding.
And locally administered, yes.
Okay.
Is it like a public health grant that you guys got from Uncle Sam?
Yes, and what we want to let people know is we understand that there are other causes of death on the Guam, and we do receive a lot of calls about financial support, supporting other causes. This is specifically for COVID-19. It's specifically for the decedents. Sometimes people call and they believe the money is for those who are still alive. The COVID-19 bereavement payment program is specifically for the families who have decedents of COVID-19. So, we just want to make it clear. Thank you, KUAM, for letting us know that this money is not for the people who are COVID-19 positive who are still alive. We wish them well. We hope they recover. Unfortunately, we will continue to lose lives around the world to COVID-19. And this is just one small way that Guam can help our families.
Right, I understand. I'm not sure who's talking in the background.
Sounds like a gathering, though.
Right. I did.
You guys, I'm on the radio.
So,
You guys, I'm on the radio, please. Take care of business, man.
right.
Yeah. You tell him, Al.
Can you just kind of explain? You said Guam Economic Development Authority. Can you explain the extent of their involvement with the with this program? Because I thought it was the Department of Administration handling the medical clinics.
Yes, because the funding goes to Tier 1 and Tier 2 mental health and clinical support services as well. So the pot of money that we're talking about covers not just the decedents payments, but the clinical services for specific mental and physical care services for our Tier 1 and Tier 2 levels of care. So that's where the Guam Economic Authority development comes in to provide that infrastructure, and the administration of the funds comes from DOA.
Okay, so GITA, is that program already ready? Grant program ready to go, or that will be ready by today?
It's not a separate program. It's just this one. There aren't two. It's considered one under the Governor's Economic Stability Health Program. Yeah.
So the GITA program is also part of the bereavement program?
It's the same. Yeah, it's the same funding source, the same pot of money, if you will. Yeah.
Right.
They're not two different grants, right?
Right. Two different grants, same pot of money.
Oh, no. One grant, one pot of money, but several parts of the program that it benefits. So the tier 1, tier 2 clinical parts, and then also the bereavement.
Okay, I'll go back and read the executive order.
Yeah, I want to go back to
Okay.
Patrick. Patrick, as the case investigation lead, what can you tell us about? I saw a crazy stat here from the. Actually, I know the auditor crunches a lot of numbers, but I guess he also crunches COVID. Here, he said there was a JIC meeting on Sunday reporting test results, and that over the last 7 days, 3,215 tests have been reported. Of that number, 379 positives were reported for a test positivity rate of 11.79%. Can you just tell us, because I know are you guys, first question, are you guys doing targeted testing now? Is that what we're seeing? Is it targeting
It depends
testing?
on what you mean by that. So as far as outreach, I know that they are trying to handle, or I guess coordinate more targeted outreach testings. But a lot of those positives are coming from our contact tracing efforts. So these are the people that we sent to our Northern healthcare facility to get tested. So these are household members, these are community members, these are employees or co-workers of the COVID-19 positives.
I wanted to follow up on something you said earlier regarding the case investigators that you had, and then some of them are kind of like part-time, some are going back to their original positions at public health, and you maybe be hiring. Is case investigation just not a priority?
Case investigation always is a priority.
Well, I only
But
asked
again-
that because you said that a lot of them are going back to their positions.
I know some of them, well, because there are other diseases going around in this island. It just so happens that COVID-19 is the sexy one for now. So like STDs, the previous investigation lead, and being the lead of this unit that's a lot of work. I have to applaud Vince because I don't know how he did it. I don't know how he was able to coordinate between isolation, quarantine, and all other units in the investigation response team while handling his STD program. I know there are others, so I think Annette has spoken about it, the mass vaccination rollout that they're going to be starting soon. So a lot of our case investigators who were with the COVID response team or the COVID investigation team are being pulled for that to help assist with the flu ILI or the flu vaccine. So case investigation is a priority and we are fighting for it. We are fighting to get more investigators on board as well as contact tracers.
Okay, we do have a question here. Is suicide covered due to COVID? Al?
Suicide is not covered under the COVID Bereavement Act. You have to have died from the natural causes of the COVID-19 viral infection to qualify, and as determined by the attending physician who signs the death certificate upon death. So no. So we get that question asked for people who have that concern. And if we do have patients and families who have suicidal ideations, then we do have a cadre of social workers to address that situation. So we try to prevent that. But no, it's not covered.
And you said you're meeting with Mr. Byrne today, hoping to get the final approval today, right?
No, not Mr. Burns. This is going to be Mr. Shane Nagata.
Mr. Shane Nagata with DOA.
Yes, ma'am.
Okay, so you guys are hoping to get the final approval today?
Oh, well, as soon as possible, Mr. Brina. If not today, then as soon as possible. We do not want to continue to have the families waiting for the support. Time is extremely important. And more on a practical sense, we don't want the funeral homes to be waiting, the morgues to be waiting, the families to be waiting as well. So we're trying to be extremely sensitive to all parties involved.
And where will people go to find the form? Should they go to GITA, to Public Health, DOA?
Right now, we are planning to have the forms available either online or paper copies available either through the governor's office or through the Department of Administration. And it's going to be distributed on a timely basis, meaning as soon as possible, because we do have families who have been waiting quite a long time very patiently. So yes, I will have those forms out, fillable forms, as soon as possible.
Okay.
Al, do you have any, as the mass casualty lead, do you have any stats that maybe we haven't seen about the COVID-19 deaths?
Are you talking about like support staff?
Or
We
any
have a whole.
statistics or data, and shedding any more light on some of these COVID-19 deaths that we've seen just an increase.
Sure thing. We have Ms. Rodolin Gerardo. She is our internal auditor at the Guam Memorial Hospital. She works for the hospital. I communicate with her several times a day. We update the database of our decedents to make sure we have the accurate information that's needed either for repatriation or for interment, services for the funerals, arrangements for the families to have their loved ones come to the island, all those things. Yes, we do have the data, the cause of death, ethnicity, age, date of birth, time of death. We have all that compiled on a daily basis. Yes.
Can you email that to me?
Well, unfortunately not, Mr. Chris, is because that is patient information.
Oh, so you don't have, Al, you don't have like a ethnicity breakdown without, the specific name?
Oh, yeah.
Yeah.
We can get the ethnicity, certainly. We can get the gender for you. Yeah. Oh, yeah. It's not, yeah, I can get that to you. But
okay.
because it's all on one spreadsheet, it's got all the cause of death information, health information in there.
Right.
What I do, I'll derive it for you. I get the ethnic information, and that I can send you. But
well, just offhand, do you know which? Do you have right now an ethnicity breakdown of the COVID-19 deaths?
I do, and just let me pull this out for you real quick. All right.
Hey, good morning. By the way, we're KUAM-FM in Agatna, Guam. We're the link. This is the Breeze 93.9 in progress now with Public Health's case investigation lead Patrick Soto and mass casualty head Al Silverio. Right now, Mr. Silverio is punching up data on COVID-19 deaths by ethnicity, and he's committed to send me a lot of information about these deaths, which we'll of course share with you guys.
Patrick, while we're waiting for Mr. Severio, could you kind of explain more about what other illnesses are of such a STDs? What kind of other sicknesses are of such a priority that we have to pull back case investigators, not focusing on COVID?
It's not so much that we're prioritizing the other infectious diseases. It's just that a lot of our case investigators, a lot of our contact tracers have their grants that they need to manage. They need to make sure that they have a job to go back to at the end of this COVID-19 outbreak. So.
Mm-hmm. Did have a comment here from one of our online Facebook viewers. Whatever happened to those 80 or so people that were trained by the University of California, San Francisco, to be contact tracers?
I think we're still currently in the process of training them. We're getting them adapted to our workflow within the university or within the Department of Public Health. So I think we have a meeting with them actually sometime this week. And then the good news too is that I'm actually supposed to be at a meeting right now with the CDC, disease investigation specialist. So the CDC sent over, deployed a team to help us improve our workflow and streamline kind of the stuff we do here.
Right.
And one of the projects that we're gonna, I guess that's on the table to have them do is help train the UOG or help kind of merge or integrate their workflow with our workflow. So I guess the short answer is it's in progress.
Okay.
Al?
All right. I'll give you the top three right now.
Okay.
We do have some who are identified as multicultural, multi-ethnic, right? But the data I have now is 12 Chuukese, 12 Chamorro, and 11 Filipino. That does not add up to 60, again, because we have mixed ethnicities here, and we do have some reporting as Asian. So that can be either Chinese, Japanese, Asian Pacific Islander, but right now it's 12 Chuukese, 12 Filipino, 12 Chamorro, and 11 Filipino. So that's the ethnic breakdown. But the rest of it I can get to you later today.
Thank you, Al.
What those are.
I appreciate it.
Are they all island residents?
No, not all of them. Some of them did not meet the 1 year requirement. I believe there's 3 of them that did not.
What is that? Oh, go ahead.
The 1 year requirement is part of the bereavement program, or
yeah.
just to be considered a
Yeah.
resident.
Yeah. Some of them are very close. Mr. Breed, I think we have some are right at the 10-month mark. But the rest of them, the other 57 are residents.
I see.
What does that data mean to you, Al? Does it mean anything?
It means quite a lot, right? It does mean that, for example, with our brothers and sisters from the FSM, they represent a small percentage of this island, but they are disproportionately highly represented in our deaths. So that says something.
What-
It says something specific.
Why?
Yeah, I mean that's of interest to us. Why is that? Why are they being represented disproportionately higher? And that's one of the things that we are working on right now, because it's not just COVID-19. It's other things on this island that we need to work on. Sometimes there's a cultural divide, a language divide, our attitudes towards them and their attitudes towards us, right? All of these things have to be bridged, not just with COVID-19, but with every health and wellness consideration on this island.
Sure. Does it have anything to do at all? Because I've heard some of the public health people come on and talk about multi-generational households. Now, I grew up in one with my grandparents and, all my cousins, my mom, a couple of her brothers and sisters. But I don't know if that's still the trend with Chamorros. But what I've heard and from public health people is that it's definitely a situation we see with some migrants from the FSM.
Yes, absolutely, Chris, and that certainly can be one. I'm not going to say it's definitely that, because I'm also from a multi-generational family.
Right.
We have lived together for many years, but as a 100% Filipino, I don't see us disproportionately represented in the COVID-19 numbers, unlike our sisters and brothers from the FSM. So it could be other things. I mean, we are a very closely knit community, culturally, economically, and our family is our wealth, right? So we
Right.
want to make sure that we have large families, not only to take care of our legacy, but to ensure that we have a good future ahead of time. Unfortunately, when we have a pandemic such as this, it affects everyone, not just the elderly, but the children as well, the very vulnerable people.
So, Al, do we need to be putting out more literature, more information, more PSAs in Chukis, maybe, Kashrayan, Pohnpeian, different?
Oh, yes, sir. And we have done just that. So we
Right.
have a really great team of our PIO individuals here with Grace and Vivian, and they put them out. We have competent translators and interpreters who put this out on a timely basis. So yes, we do. We have those. We have
Right
those
on.
PSAs.
Well, we're going to up our game, too. I'm going to start bringing on some of our friends from the FSM consulate office and out in the community just to get that message out.
Right on. Thank you. Thank you.
Thanks, Al. That was actually some really good information you provided in terms of the breakdown, and also just the information about the bereavement program, because I know a lot of people have been waiting to hear about that. So it's good
Oh,
to hear
yes,
that.
ma'am.
Yeah, that something hopefully might be moving this week.
Right on. Right on. Thank you. Thank you.
Patrick, I just before we close, I want to just go back to you. So the results we're seeing now are
What was that?
that was Jason. The results we're seeing now are close contacts of known positive cases. And are you also
Sorry.
testing people with? Go ahead.
Oh, go ahead. No, sorry. Go ahead.
Are you also testing people with symptoms? Because we got a message here. Someone is asking, where can they get tested and what's the cost?
So if they want to get tested, they can always go to their primary healthcare physician. If I think that one they do have to pay out of pocket. But if they want to get tested at the Northern Healthcare Facility and they're not identified as a close contact, they can call the Northern Healthcare Facility number. I don't know if you guys have it on hand, but I'm able to provide that right now.
Thank you.
Do you want it right now?
Yeah, go ahead.
Okay. 635 7525 or 7526. So if they're not identified as a close contact, unfortunately there's nothing I can do. I'm not going to send them out to the Northern Healthcare Facility to get them tested. But what they could do is call the Northern Healthcare Facility and get themselves.
Okay.
Okay.
Yeah, and you know what? It just dawned on me, Patrick. Now I remember who you are. You called me about our situation. Hello. Okay.
Has been, yeah.
Hi. Okay. Anyway, yeah.
Yeah.
Just-
All right.
I was like, why does his name sound so familiar? Now I know why. Okay.
Yeah. Al, anything in closing you want to add here?
Thank you for helping us get the word out, Mr. Chris and Ms. Sabrina. We do appreciate it. And to all the people out there, stay safe. Practice your social distancing. You've heard this a million years now. We're here for you, and thank you. Thank you for your support.
All right. Thank you, guys. I know you guys are working hard, probably stressed out.
Right.
Thanks a lot.
Thank you all in
you.
advance for that data you're going to send later.
All right. Thank you, Chris. Thank
Appreciate
you,
it.
Sabrina.
We'll see you,
Take care.
Patrick. Welcome to the link, Patrick.
Thank you so much.
All
Okay,
right.
bring some friends next time. I'll see you, Al.
All right, take care. Bye-bye.
Wash your hands. All right, we got to take a quick break, and then we're coming back with.
Should we make this announcement really quick?
Yeah,
from
we
the
should.
Post office?
Oh, please, yes. Sorry, yeah.
So today may be a federal Columbus Day holiday, but the post office is still